we cannot work with communities without considering their context. And what I mean by that is we need to ensure that any type of public health intervention is conducted equitably. And in order to do that, we need to meet people where they are.
Welcome to the Public Health Millennial Career Stories Podcast, episode number 17. Hi, everyone. My name is Omari Richards, and thank you all for joining me today. I wanted to make a correction. So, in the intro of this, I made a mistake and I took out that this person also has an MPH. So, they have two master's degrees, a PhD and a PhD. So, just wanted to make that correction right there and then. But this episode has it's a very unique story, and I hope that you all take some value from it. And so I also wanted to announce that I will be starting a new job on October 1st as a health program officer for the Kate B. Reynolds Charitable Trust in North Carolina. I will be doing an Instagram live sometime soon. So be sure to follow me on Instagram to find out when that will be. That is at the PH Millennial. So the PH Millennial. And definitely be sure to check it out there. And if you haven't subscribed to this, definitely subscribe and share it with a friend, leave a review, and I would greatly appreciate that. But without further ado, here's today's episode. This is the Public Health Millennial Career Stories Podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Today, we have someone who immigrated to the US from Ghana when she was 16 in order to further her studies. She has been able to not only get her bachelor's in biomedical engineering with a minor in chemical engineering at the University of Virginia, and her master's in biomedical sciences and biotechnology at the University of Massachusetts, but also has gotten her PhD in management and health policy at the University of Texas Health Science Center at Houston. She currently works as a health services and system researcher at the CDC via the Bizzell Group LLC. We have Dr. Sharon Attipoe-Dorcoo. Welcome to the show.
Thank you for having me, Omari. It's really an honor to be here and just take the time to reflect on some moments of my life that I really haven't thought about in a while. So happy to share pieces of it with you.
Well, I'm really glad to have you on, and I know you have a very unique story, so I'm really happy that you're taking time to share it with all of us today. So how are you doing today?
Man, Omari, taking it a day at a time. We have three little ones, and between one of them is a toddler, so getting the toddler engaged, the two older ones with virtual learning, and trying to coordinate my husband and our schedules for work as well has been a bit overwhelming. But just learning to lean into my faith, my community, and just depending on just each other as a family, and taking, like I said, taking it a day at a time. It's overwhelming, but we would rather be safe and be overwhelmed than anything else. So thank you for asking.
Yeah, absolutely. And you keep it safe. And I know it is a very challenging time for a lot of parents
Yeah,
out there. So I am keeping you and all the other parents in my mind while we go through these tough and trying times.
thank you.
My pleasure. So tell us a little bit about your personal background.
Yeah. Absolutely. So I don't think I could tell you about myself without really acknowledging my identity, right? Because it's really at the forefront of who I am. And it's helped me through my self-discovery and really be able to articulate what that means. And I think myself and other immigrants, if I can speak to at least some, tend to go through this. We have this complexity of we're here, but we're not from here, and where really is our home. And I went through that a little bit, being from Ghana, who came here when I was a teenager and just practically had my bubble burst, I'm trying to learn about a different country, learn about different culture, and still really maintain some of the values that I grew up with. But over time, even though the complexity of human beings, I tend to describe as very complex as a spider web, I have really been able to fine tune what I think mine is. And I call myself just, but I have different buckets and I can just go through them. So literally I'm bicultural because I'm Ghanaian American, and I'm a fiery millennial woman, a Jesus follower. And I think this is very distinctive because I know there's obviously different beliefs that folks have. Christianity, Islam is the Islam faith, what have you. However, over the years, I distinctively say I'm a Jesus follower because I've learned that Jesus was somebody who loved fiercely, beyond any label, beyond any denomination, and that really is sacred to me. So I find that very powerful to really distinguish myself as a Jesus follower. I'm a wife, a mom, a scientist. I say scientist because it's an umbrella that covers all my professional experiences, from policy, from health services research to evaluation. I do economic evaluations, so sometimes I get called an economist. However, I think when I put all of that into under one umbrella, a scientist really defines it. And then I'm an author. I wrote a children's book and that I published recently. And last but not the least, I'm an aspiring trailblazer in the field of health policy, or health and policy is what I like to say.
Well, I'm really glad to hear that, and thank you for sharing all those wonderful things. And I'm look forward to dig into a little bit of some of those right now.
Mm-hmm.
So what does public health mean to you?
That is a very good question. So I think a story really clearly states this better than I can even define it in any term. So I came to public health from the engineering sciences, so really very structured in terms of systems and how they relate. And to be honest, that actually has served to my advantage because that is truly how I see public health. We need to really think through how we work with people systematically, in my mind. And the typical example is, so a few years ago, I made a choice to monitor the salt intake in my family. And I discovered celery salt, which has lower salt, lower amounts of salt, but it's very flavorful. And when I discovered that, I wanted everybody in my family to know. So my family in Ghana, and I literally unknowingly, I wanted them to know that there are ways to reduce your salt intake. And I didn't stop there. A few months, perhaps, I would say, we decided to go back home to Ghana, visit the family. And guess what gift I brought to my in-laws? My mother-in-law, I brought her celery salt. And I illustrate that because we cannot work with communities without considering their context. And what I mean by that is we need to ensure that any type of public health intervention is conducted equitably. And in order to do that, we need to meet people where they are. So here I was raving about this new discovery. How else will I actually be able to convey the message to their context if I don't actually present that option to my family? And being able to go through that experience and being able to, again, reiterate some of the core fundamentals of public health, which is prevention. And with my work now in heart disease and stroke, it's very relevant to keep your salt intake at a minimal if you can. That alone, or that example alone, tells me how we can systematically think through how we work through public health interventions, meet people where they are in their context, and also think equitably about how we ensure they have access to any type of public health intervention that we have framed up, be it from the focus of access, from the focus of cost, or even the quality of those interventions. So that's what public health means to me.
Yeah, thank you
Long
for
answer.
sharing. Yeah, and I think it's so important to have those equitable, like a lens for equity, and also just really making sure you're meeting communities where they're at, because that is part of that equitable lens and really approaching it in that sense.
Mm-hmm.
So I know you left Ghana when you were 16 to further your studies in the USA.
Yeah.
What was that like, and tell us about that process?
Amari, it was tough. I was 16. I grew up in like I said, a protective bubble with my mom, my grandparents. I was actually raised by my grandma because I lived in a communal house with my extended family. and it was wonderful. My grandma really took me everywhere because my mom had to work. So I had that communal, family support that was there. And then one day they literally called me and said, "So your dad," and so I didn't really grow up with my dad. My dad was in the U.S. working at that time. "Your dad would like you to move to the U.S. to further your studies." And I'm like, no. uh, but at that young age, what they got me to understand, and it's no surprise that there are opportunities in countries that are considered by the World Bank as low and middle income countries. So there are opportunities that tend to be sometimes limited in those countries. Some necessities such as education could be one. So you can be extremely smart and capable, but then there could be barriers, again, access or maybe cost, because education at that time was not free. It was paid out of pocket for parents back home. So they made me realize the importance of thinking about my future. It might be tough right now, but then the future, or what they foresaw for me, the vision that they had for me, and that I should have for myself, is bigger than that current moment. So I said, okay, packed up and moved with my dad. So my younger brother, or half brother and sister who were younger than myself, and my stepmom, we all came to the US at that time. And they actually had to leave because they were still younger. My brother and sister with my stepmom, so they left and they moved back later. So throughout the course of my journey in high school, I would say, even though it was trying, there are really moments that I truly cherish. It gave me the chance to get to know my dad better. I was really blessed to have a couple of close friends. I don't have many friends. I have many acquaintances, but they're really close friends that I still have. I had some phenomenal teachers. I literally can remember one who told me, and I didn't think about this till now. She said, Sharon, because there was one class that I did not like, and I didn't like going to it. And she told me, Sharon, sometimes you have to do what you don't like so you can get to where you want. And I think her name was Mrs. Toller, this wonderful Black woman. I remember her clear as day. Maybe she might watch this. I remember this. But when she told me that, and it still sticks with me, it gave me a sense of, okay, things can be challenging, but we're always going through that process as human beings and discovering, what we learn as we go through those journeys in life. One of my favorite heroes of all times, my grandmother, she really instilled a sense of faith in me at a very young age. So during those tough moments when I was here in the US, I found myself leaning more into that. So my church community became a critical part of my life, so much so that there was a woman in the church, and I can't remember her name right now, sadly. She actually went far and I had to even purchase items I needed for college when it was time to go to college. The pastor at the church made time out to ensure that there were some things that I needed. So I ended up having my community just grow and bloom with, again, my friends, my extended family that was here in the US as well, because I do have aunties and uncles, several areas in the US, and that really did help. And help build that resilience that I think really has helped me now in the current phases that I've gone through as I've grown and matured in this country.
Okay. Yeah, thank you for sharing that.
Thank you.
So I know in an article I
Yeah.
read about you, which I will link to in the show notes for anyone who's
Mhm.
interested. You said that one of your mentors said, find your own path in your career and be open to opportunities for career options that may not even exist yet. Do you want to
Yeah.
just talk a little bit about that?
Absolutely. So I have a number of mentors, and I'm very fortunate to have that. But there are two that I think have been most influential in my life thus far. I'll speak about one of them, and I think we have time for me to speak about the other. And that is Dr. Luz Claudio, who is a professor at Mount Sinai. And during one of the several internships or fellowships that I've had throughout my career. She had a session with all her interns or fellows, really, technically. And when it came to my one-on-one, those are the exact words she told me. And what got me, or what I found very unique about that statement to me, was it's something that already sat in my spirit. And her saying that just confirmed what I felt in my spirit. I mean, I came from the engineering sciences to public health. So that alone was me already creating a path that didn't really exist, because not a lot of folks do that. That statement still sits with me today because it really illuminates how I think and I approach problems in the world. I think it is how, so I'll give you a quick example, that I took a class on knowledge translation, and we're talking about how knowledge really goes through several modes of being communicated through populations, right? So, and a good example I can think of to illustrate this is, I don't know if you remember this from any of your classes when you were younger, when you're doing sound waves, and then one person puts the side of the cup to their ear. And really, to me, from, again, my engineering brain just clicked in that class that sound waves are, waves going up. And if you can really trace information or knowledge going through those waves, they do have peaks and they do have bounds, right? Depending on who has the information, right? The way they're presenting the information and how that information has been absorbed. So I illustrate that to say that that statement allowed me to really open myself up to all the knowledge that I've accrued, even if it's in a different setting, how those really are relevant in my current setting or my current field that I study.
And I think that's so important because public health is such a multidisciplinary, interdisciplinary field, and coming with those different perspectives with different backgrounds and different knowledge sets really does help shape how you can view the field. And another thing is, like, public health is a forever changing field, and especially now with the pandemic, there are going to be a lot of positions and a new career paths that emerge out of this. So definitely not staying focused on like what has been, but what is going to come in the future, because there are going to be so many different opportunities.
Absolutely.
Yeah.
Couldn't agree more.
I'm glad to hear that. So jumping into your schooling career, so you did your bachelor's in biomedical engineering with a minor in chemical engineering at the University of Virginia, and you mentioned to me that you took a little bit of pre-med classes in anticipation for medical school. So tell me why you decided to get this bachelor's degree in biomedical engineering.
I am one of those girls who, rather than spending my money, and I don't get me wrong, I liked fashion, but if you gave me a choice of buy the latest fashion or buy the latest technology in the market, I'll go for the technology. So naturally, those things, I gravitated towards those things. I learned by curiosity. So I like to see how things work. I can literally just take something and pull it apart and be like, oh, so that's how it works. So that really was who I was, right? And perhaps still am. So needless to say, I really think, again, going back to when we started talking about my journey in systems thinking, I really think that's where it came from the field of engineering. And I really was one of those in high school that I didn't have to study, because when I came from Ghana, in secondary school in Ghana, the level of classes or the level of lessons that we had then were to me, compared to the high school classes I was taking, were way advanced. So I didn't find myself having to study to get through high school. So perhaps the only classes I had to really focus a bit more on, because it was new to me, was courses on U.S. history or government, etc. Because that obviously is different, right? So I feel like I breezed through high school. However, again, as a curious learner, I struggle with standardized tests. I don't do well on tests. So the SATs really woke me up. It's like, oh, okay, we do need to study for this. And that reality continued into college because things got a little bit more technical very quickly, especially with wanting to study engineering, and I really needed to readjust my study techniques very quickly, and it was a humbling experience. Let's put it that way, for me to quickly realize that yes, my ways of thinking I can breeze through things just because I can naturally pick this up very quickly was not going to work for me. So I learned that very quickly, adjusted, and like I said, went through the courses for my biomedical engineering major. I was very much interested in chemical engineering for some reason. I don't know why, so I minored in it. And I did take those pre-med classes because I envisioned myself going to med school. But then those standardized test weaknesses that I have became a reality very quickly. I took the MCAT once and I didn't do well, and I just saw that as a sign. I didn't want to retake it again, and I think I am happier now. I don't think I would have wanted to be a physician just because of what I've enjoyed doing so much so over the years in public health. So I think it was a good idea to pay attention to the universe, and when I didn't do well, recognize that okay, that was the universe telling me to perhaps this is not your path, so find your own path.
Yeah, absolutely. I definitely resonate with that also. I took my MCAT twice,
Mm,
and I'm absolutely glad that I did not pursue
mm,
medicine. I am very
mm.
happy where I am, and I'm very
It's
happy
awesome.
to see where my future leads. And I'm glad to have this podcast to show the stories, like, because a lot of people coming up in public health and health in general,
Hmm.
just they want to go to medical school because that's basically
Yeah,
all they know, that's all they talk about.
right.
And there's so many different paths that you can help people with and not go through the stressful and the debt-ridden path of medical school.
Yeah.
So I'm just glad to really share those stories. So you said that you breezed through high school, but then
Hmm.
in undergrad it was challenging. What were some
Hmm.
of the things that you had to do to readjust to really set yourself on a path for success?
So for me, if there are a couple of things, I suppose. The first one is recognizing. So again, going back to the identity topic, right? And realizing, okay, first of all, why am I here in this country, right? I was given the opportunity to come here to really further my studies. And then thinking also so that's sort of the why. And then thinking also to the end goal. I do want to go back home at some point. What am I going to show for it when I go back home? And I think that mental pressure alone just got me thinking, oh shoot, I better get it right. So that's the first thought. And then the second thought is really, and I think that was when I actually started to think through how to ask for help. I'd never really seen that as a need. I just always thought you knew it, so you just do it. So I started realizing and learning why, oh, that's why they have TA sessions. That's why you have access to your TA, you can email them, you can set up time and talk to them, and ask questions. So I started quickly learning how to go to school in the US, if I can put it that way, and really use the resources that were available to me to, again, know my why and meet that end goal of, okay, what am I going to show for when I go back home to
Okay. Yeah, thank you for sharing that.
Ghana? Hmm.
So when in your undergrad journey, like, did you say you wanted to go to med school, and when did that kind of change? Was that only after your
Mm.
MCAT, so you're like, oh, I don't want to go anymore?
Yes, definitely after my MCAT, because I would say I did enjoy most of my pre-med courses. I didn't care too much from organic chemistry and the lab that went with it. But I think for the most part, I enjoyed most of the other classes. And with the engineering classes, some of, especially when it came to the physics and the chemistry, those tended to overlap anyway. So it was when there was a bit of a digression to organic chemistry and a couple, well, maybe that was really the only one that, yeah, I wasn't too thrilled. But in the end, I think even though I didn't go, those classes still played some minute role in at least the knowledge that I've gathered over the years.
Yeah, absolutely. And organic chem is a very tough class. Like, and yeah, let's
Do
just
you
not
want to
let,
share your
no,
experience?
no, I do not. I do not. That was not a fun time. I want to say I took organic chem at either twice or three times. I definitely failed my first time. But let's not go into that.
Okay, I don't blame you.
So after your bachelor's, you decided to do your master's in biomedical sciences and biotechnology. What was the thinking process behind doing this? And you also did this at the University of Massachusetts.
That's correct. So there were a couple of things happening. So I'll start with the personal. So on the personal side, after I completed my bachelor's degree, this was still in Virginia. So during the completion of my undergrad was when I met my current husband, then boyfriend, and he was going to school in Massachusetts. And so when I completed undergrad, there was a question of, am I going to look for a job here, or do I want to go where my heart is? And because he couldn't move. So I said, okay, I'm going to start looking for jobs in Massachusetts. And fortunately, I found one. So I moved there, and we started life together at that time. And then when I started working, I was working as a medical assistant in one of the hospitals there. I don't know, there was just something in my spirit that didn't quite think the learning was done yet, so to speak. And it could also be part of what I said earlier about thinking back as an immigrant, the why now, and then going back home, what does that mean, and what do I foresee myself for that end goal? So needless to say, I started looking at different schools and what I could study. I knew I liked engineering, but I didn't want to get my master's specifically in engineering. I wanted something that sort of was still applied and still in, again, there was nowhere I was moving out of the health umbrella. So I found this class or this course, rather a degree, that was being offered at the University of Massachusetts under the umbrella of biomedical science and biotechnology. And again, it feeds to my love for technology. It fed to my interest in what I saw in terms of health technology and what was being used in the hospital as I was working there. So all of those kind of fell into place. And when I applied, I got it. I spoke to a few professors there, and I really liked what they told me. So I applied. And like I said, when I got in, I felt like all the ducks were in a row for me to go ahead and do it. So I did it, and amazingly, I actually completed it in a year and a half. And it was really great. I learned a lot. I remember taking a class that I never thought I'd take on plant biology, and that was very interesting. And I did very well in it, surprisingly. So yeah, it was a really great and interesting time. So yeah, personally, I was happy. So yeah, it all worked out.
Okay, and that's great that you were happy and you were able to maneuver that move with your now husband. So what was some I guess no, when in during this program, were you thinking about public health, or was public health something that's
No,
foreign to you?
it was still foreign. It was somewhere in the back of my mind, and I knew folks just in hearing about what folks were doing even back home. I heard a lot about environmental public health folks. Amazingly, for some reason, I don't know why, there was a lot of that going around. So it was just okay, something to know, and okay, that's great. But it never crossed my mind that that was really what I wanted to do. And maybe we're gonna jump into it very soon in your next question. But what really stood out for me was when I completed the master's degree. I got a job where, again, the health umbrella, where I was working for a company that manufactured medical equipment, specifically histotechnology equipment. So when you go to see a doctor or physician and there is a biopsy that is done, that biopsy is then sectioned, put onto slides. Pathologists read. There are some the technicians or technicians that do the histotechnology and can understand what the section, but to actually make diagnosis, there are physicians or trained pathologists that actually read the slides and are able to give diagnoses. So the equipment that did that was what my company manufactured. So I traveled through several states in the US, more in the southern states, training from the technicians to the pathologists how to use the equipment. If they, the pathologists technically, if they choose to, they tended to really work. I worked with them more on the state and quality and what they expected to see under the slides when they read them. And just troubleshooting issues here and there, not actually installing the equipment as needed. So that was what I did for almost a couple of years, I want to say. But life happened. So when we took that job, or when I took that job, my husband and I actually ended up moving to Georgia. And we're living life, right? And then, like I said, life happened. I was pregnant with our first child. And here I was traveling every time for the job. Secondly, there are chemicals for the histotechnology process. And the one of them specifically is xylene. And at that time, and I don't know if research has shown otherwise now, but at that time, I read about issues with exposure to it when you're pregnant, and that concerned me. So, needless to say, based on those two reasons, when I went or took the maternity leave, I took it early. So it gave me a chance to just sit and reflect on what I wanted to do for the next chapter. Do I want to go back to doing this when the leave ended, or did I want to start thinking through what I wanted to do again, that big goal of when I go back home? So it was throughout those times of reflection, really, when I was like, so I've been doing this, meeting all these wonderful clinicians, wonderful technicians in our healthcare sector. But then I wonder, what are the decisions, the behind the scenes big decisions that are driving why we're even doing this the way we're doing it? So, and at that point, I don't know whether it was really public health, but at least policy came to my purview. And so I started going online to read more about health policy specifically. And that's when I started seeing the linkages with public health. And then it was just like the light bulb went off in my head. I'm like, oh, okay. So those folks that I've been talking to, or that I at least knew about at the back of my mind, that were doing environmental public health, and there were people that I knew that were doing something more along the lines of health promotion, but I didn't know what that really was all about. And throughout the research, it became very clear to me as mud, as some people will say. It's like, okay, I read about epidemiology. I was like, I don't think I want to do that. I'm not interested in surveillance. Although, funny story, that's the folks I work with now, funny enough. But needless to say, that was the moment of enlightenment, if I may. So I chose not to go back to work. I chose to look into going back to school and going for school to first get my MPH and then my PhD, and here we are. So I'll stop there and have you follow up with more questions.
Yeah, absolutely. Thanks for sharing that. So you decided to get your MPH and PhD. why did you decide to get one over the other? Why didn't you decide just to get your MPH or just to get your PhD?
Very good question. So the PhD was definitely the must for me, if I could say that, because during my reflection, again, that ultimate goal that I was talking about when I go back to Ghana became very clear, and that was to be associated with the Ministry of Health in Ghana in some way. I still don't know what that means, but some way. So, and in order to do that, and from my experiences as a Ghanaian woman, sometimes speaking evidence requires for you to have a certain level of credibility. And that credibility sometimes needs to come in the form of a degree. So for me, the PhD was like, okay, this is it. I will have that. So when I am actually speaking of evidence that anybody else can probably know, I'll be taken more seriously. So that was one. And then secondly, the MPH route was actually not much of a choice, because I came from a field where the concept of public health and being able to even get a degree within public health was there was a bit of a gap. So being able to get the MPH degree was almost me filling that gap before being able to move on to the specialization, if I may, of the health policy track. Makes sense. So fill the gap with the MPH, get the foundations of public health, understand what this is all about, and then further take it into the realm of specialization in health policy, or specifically management and health policy.
Okay, great.
So that was it.
So was your MPH also in management and health policy?
So for the MPH route, and some of these were determined by my school and the restrictions that were available. So they had a track for health services research for my MPH track. So that's what I did. And then when I did the MPH was when I went into focus on the health policy. And even though the degree is offered under the umbrella of health management and health policy, within that, there are folks that really narrow down on the management track and then the health policy track. And obviously, the policy track was what my heart was for. So.
Okay.
Yeah.
And you did both of these at the University of Texas Health Science Center, correct?
Yep, I sure did. And I would like to add that during this time, so the personal life part was still ongoing, right? I've learned now that sometimes we try to separate them, but you can't really. So I look at there are 3 kids that I have now, and I look at all 3 of them, and each of them set a particular pivotal moment in my career path. So my daughter, remember, she was the first and I was pregnant with, that got me thinking of my final path or my future path. And so when I look at her, that's what I attributed to her. She really got me started on that path. My son, or my older son, is the one that got me actually implementing that plan, because I took my GRE when I was pregnant with him. And then finally, my third baby, who's my second son, he really was the one that closed that chapter for me, the chapter of the degree, I mean. And what I mean by that is when I was working through my dissertation work for my PhD was when I had him. So staying up late, trying to feed him and get him to bed, it's like, well, then we might as well just get this writing done and be out the door. So I attributed my accomplishments in these pivotal moments in my career to each one of them in a different way. So
thank you for sharing that. Yeah, I appreciate that. And I hope that they get to go back in the future and look at this and really appreciate how they have shaped their mom's life and their life, and just really appreciate
I hope so
that.
too. Yeah, they played a big role, whether they know it or not.
That's awesome. So if there were there any times during your MPH program or any moments that stand out to you as being pivotal or really helped in shaping like what you wanted to do going forward, or solidified that, yes, I want to do health policy?
Yeah. So I wouldn't say specifically for health policy, but a reassurance of the fact that this is a path that I really want to be on. So there are two of them actually. Was when I took biostats. I loved that class. It's like, and for a while, my husband actually wanted to get me to just fully focus on biostatistics. But then, I don't know, it could be my bias and my stereotype. I didn't want to be that. So I need to give context here. I tend to be very well versed in the right brain, left brain. I can be very personable, and also when it comes to just hidden technicalities, and just grind, whether it's quant, whatever you want to call it. Quant, I said quantitative, sorry, quantitative work. I can do that very well. And I didn't want to be fully on that side, one side of the spectrum. I like the balance of being in both worlds. So I found that if I chose that path, perhaps I was going to lose the other side of me, and I didn't want to do that. So taking that class again, I loved it. I was like, okay, so this is it. I made the right decision. So that was one. And then secondly was my advisor. This advisor truly appreciated the fact that I came from engineering to public health. He really saw the potential of what I've been training, what I learned, and how that was so applicable to public health that I could not even make sense out of at that time. And I think those two moments were so valuable to solidifying the fact that I made the right decision at that time.
Yeah, I'm glad to hear that, and that definitely does mean a lot, because usually a lot of the times we do not see like how our backgrounds can translate to the work that we're doing, or how it's helpful or gives us this new perspective, but other people do see it. So that is great. So during your PhD program, you did an internship at the University of Cape Town in South Africa. Do you want to talk a little bit about how you got this internship and then what you did in it?
So I guess this would be a shout out to the Mount Sinai program. So Dr. Luz Claudia, who is one of the influential mentors that I mentioned, has this program every year, actually. It's a global initiative funded by NIH, where across the nation, anybody can apply, MPHs, PhDs, and you get sent to a few different countries, either in Africa or I know folks have been to Ireland, some countries in Southern America as well. And you really just stay there for a couple of months, whatever country you're stationed, stay there a couple of months, work with a mentor, local mentor, and work on a project in that area. So I found out about this. I don't even know how. And that's one thing about me. I tend to look for stuff. And probably it's because when I was growing up, and I'll take a jump back and come in time and then come back. When I was growing up and during college, I always wanted to be somewhere in the summer, because it gave me a break from my dad. So I'll just look for research opportunities, internships, what have you. So that carried along. So it might have been one of those moments I was searching for something to do in the summer when I was doing my PhD. And I came across this opportunity, so I applied and interviewed, and I got in. And I was placed in. I can't really remember if there's a process she goes about with her how she pairs the mentors and the students. I can't remember fully well, but needless to say, I was paired with a researcher in South Africa, Dr. Jennifer Moodley, amazing woman who does work on HPV in South Africa. So needless to say, I met one of my pivotal or influential mentors of my life during that time, and worked with phenomenal researcher, and throughout that process too, one of my colleagues that I work with there on the project is also someone who was in my network now. So my network also grew as a result, right? And on the fun side, I got to see Cape Town. This country is amazing. And the best way I like to describe it to folks is, if you can imagine living in the US and thinking that, no, I'm not in the US, but on the continent of Africa. That's Cape Town. It's amazing, but it also has all the complexities of inequities that we see here in the US. And it's so stark that it's physically present. You see it as soon as you hit the airport and you're driving. You see the shanty towns on one side and you see luxury on the other. I just don't know how to describe it. It's just more of a visceral reaction when you get there as to how physically present it is, but yet so, just like for most folks who have encountered people from the continent, just so much love, so much joy, and just fun. So really, really got to explore meet some amazing folks there. And on the career side, that was actually my first publication as a social scientist. I'd had publications throughout when I was in the biomedical engineering sciences, but nothing in the social sciences yet. So that was my first publication, and it really just reiterated my interest in international work more. If anything, it just confirmed it that yes, this is definitely a future I like.
Okay, and that sounds like an amazing experience. Not only
It really
just
was.
just not
And
only just visiting. Yeah,
I
not only.
completely agree.
Yeah, I'm glad that you got that experience. So was it challenging going from your MPH to your PhD, and was that like a what was the application process for that? Because I know for me, when they were trying to get me, they were trying to recruit me into a PhD program, and like I know it. One thing of going to a PhD program in the same school is that you can sometimes reduce the amount of time that you have the program because you already took a lot of the prerequisite classes through your MPH. So was that the same similar experience for you?
That's a very good question. So I was actually encouraged by my advisor again to actually not limit myself, because I was just gonna apply to that same school and stay because of the exact same reason, right? You've taken most of the courses, you kind of know what the structure is, so you can plan very well. And he really encouraged me to apply to other places as well. So I did that begrudgingly, I would say. And the other reason too that I thought his advice was worthwhile was, remember, we were in Georgia and I was going to school in Texas. And there was actually a reason why I became Texas. And at that time was because my husband got a job with a company that really had a home base in Oklahoma, and they had to be they needed his physical presence there. So the question was, and at that time we only had the 2 kids. The question was, okay, he's gonna go stay there for most part of the week and be coming back and forth, or since I'm already on a transition of finding schools, should I find a school that was in some close proximity to ensure that there was some type of harmony in our family. I personally didn't want to live in Oklahoma, just because I lived in Georgia and I just wanted something of that had more of a big city feel. And I know Oklahoma City has that feel to some extent, but I just personally didn't see myself living there. And to be honest, he didn't actually live in Oklahoma City. He lived on the outskirts and more rural, that I didn't see myself thriving well. So needless to say, I said, okay, Texas is right next door. Texas has a lot of great schools. So that's what really prompted my searching and applying to schools, and ended up in the University of Texas to begin with. So that's the backstory there. But when it was time for my PhD, he had actually done so well, apparently, that his promotion put him back at headquarters in South Carolina. And so during all that time, we kept our house because we know this was a temporary phase in our lives, right? So he was able to go drive back and forth from Georgia to South Carolina. So here I was, I'm like, okay, we moved here and now you're going again. So what am I to do? So it was during that time where I said, well, maybe it makes sense to look at some Georgia schools as well for my PhD. And I ended up speaking to a few schools, a few professors at the schools. And I would say I got my answer very quickly, for the University of Texas. And there were some delays on the schools in Georgia, and it ended up not when I found out. And eventually, I was on the waiting list on one of them, and they ended up filling the role. So again, the universe was trying to tell me something. I said, okay, well, it wasn't meant to be in Georgia, and here I am. I got in the same school, so why not? It's easier. Challenging on the personal side, right? Because here I will have to try to maneuver the kids. I was fortunate though, my mom was with us at that time, so I was able to have that person who was there to give that support, just like my grandma was for me. And that really made that personal part of it a little bit more bearable, and be able to still stay at the school and be able to take care of the personal side as well.
Okay, and thank you for sharing that.
Mhm.
So, jumping ahead a little bit, I know after your PhD, you did a postdoctoral or ICE economics fellowship. So, can you talk a little bit about the process for applying to that, and then what you did in this fellowship?
All right. So when I was finishing up my dissertation, I was actually fortunate. I applied for a few jobs because you sort of want to do that before you're fully done, right? And I got a job with a company that did contract work for CMS at that time. And it was really great, except for when I found out 2 days before I started that I was expecting my third baby. So again, to speak of crossroads, so I hit another crossroad, and I had to make the decision of, can I handle being pregnant, being started a new job, and trying to finish my dissertation work, the wonderful life of Sharon, right? But then I said to myself, you know what? You don't know if you can handle anything until you try, right? How else am I going to know? So I said, okay, let's try this out. So I stayed the course. I worked. I wasn't sleeping anyway, so there were a lot of grueling hours for this job. So it sort of worked, although one would say not sustainable. And yes, that reality came very quickly after I had the baby. And there was one moment we were still on a call way past like normal work hours. Crying baby. My husband was traveling for work, trying to make dinner for the two older ones. I'm like, okay, this is not going to work. And I just had that moment. It's like, Sharon, you went to school to get a PhD so that you can at least have some flexibility in your options and choices, and this is not working. So I spoke to my supervisor at that time to see what options were available, and they had a pretty hectic demand of projects, so the reduction of hours was not really going to work out. So I said, okay, then I just need to walk away and just regroup and refocus, and figure out what I really wanted to do to find that work-life balance that I needed. So thankfully, though, while I was working with, I was able to, again, when I spoke about, being able to finish up that dissertation because I was taking care of the infant anyway, that paid off. So the degree was completed, and I had that work, at least had that work experience under my belt as well, right? So I spoke to a few folks in my network, and this is where I'll make a plug for not only mentorship, but networking. It is so key. And especially for folks that are starting out early in their career, I'll say just if you see an opportunity that you're interested in, don't be afraid to just put your name in the hat. I'll talk about this experience and go back to your original question, Amari, because it's sort of related. And this experience is with a professional organization called Academy Health. When I was getting my degree or working on my graduate degree, I came across this opportunity call that said, we're looking for applications for students to be a member of our board. It was the first time that call came out, and they were looking for student representation on the board. It's like, oh, okay, let's give this a try. Now, again, I put my name in the hat, but then in my mind, I was doubting myself because you had an option of recommending yourself or having somebody recommend me. I was like, I'm not going to waste anybody's time to recommend me. I'll just put my name in the hat. I get it. If I don't get it. If the universe wants me to get it, I'll get it without somebody's recommendation, was what I told myself. Needless to say, I got a call a few months later saying, oh, by the way, are you still a student? Are you still interested in joining the board? Yes. Okay. Actually, maybe it wasn't a call, it was an email. And then a few weeks later, ta-da, guess what? You're a member of the Academy Health Board. So I can now say I am the first ever student board member of Academy Health because I took a chance. And through that network was how I was able to set up an informational interview with one of the members of the board. And throughout that process, they encouraged me to look at CDC and look at their fellowships. Needless to say, right after that call, I went online, applied to all the CDC fellowships that were available. I was fortunate to get the letter of recommendations that I needed from, again, other members in my network. And not long after, got an email about an interview with so this was with the division of, it's actually now an office, really, CDC lingo, the office of, the community guide office, rather. And throughout the interview, they really sold me, or the position description as well as the interview really sold me on doing systematic reviews. And I obviously had done literature reviews, but I didn't see myself as really having a hone in on systematic reviews to really add that to my toolkit. So I saw this as an opportunity. Not only that, so I had a couple of interviews. On the second interview, there was a representation there from the economics team, and I was scratching my head. I'm like, your description never talked about economics. Why is there somebody for the economics team on there? And then he asked me a question during the interview that would I be interested in doing economic evaluations with him, as opposed to what they were looking for at that time, which was somebody doing effectiveness reviews. So when you're only looking at the effectiveness of the interventions. And really, the office provides technical support to the Community Preventive Services Task Force. And I don't know how much folks know about the Community Preventive Services Task Force, but in the US, there is a nonpartisan body called, and I'll start with because they're sister organizations or task forces, if I may. There's the US Preventive Services Task Force, and that task force is responsible for clinical recommendations. So for example, if you go to your physician say HPV vaccines are recommended, that's sort of their role. And then the Community Preventive Services Task Force is more interested in how we ensure that communities actually have access to, again, if I'm using that same example, how can we ensure every person, every population, everybody in the community can actually access that vaccine? So how can we do better? Be it education, be it put in individuals or working with individuals in the community, whether it's community health workers, to encourage the process of actually getting people to get vaccination. So that's sort of the differences in how each of them operate. And the role of the systematic reviews was to inform the evidence that goes into these recommendations for the Community Preventive Services Task Force. So in a nutshell, I ended up saying yes. No surprise there, right? If you know enough about me now. I said, sure, why not? I did a bit of economic evaluation throughout my graduate degree, but again, one of those that I haven't really fleshed out, skills I haven't fleshed out quite well to really say, yes, I have that expertise. So this provided the opportunity to do that. So I took it. And joined. So that person became my mentor. So that's the second influential mentor in my life thus far. And he, Dr. Chatopadai, he, on the first day when I walked in through the door, told me that, Sharon, and this is April, Sharon, we have a community preventative services task force meeting in June, and I would like for you to present to the task force. I chuckled. Because I was like, he must be kidding, right? So we went through the rest of the day. And so the next morning I went back to him and I said, so I just wanted to confirm something you said yesterday. You had mentioned something about a meeting in June and it's April and you wanted me to present. He said, yes. Okay. And what do you think I did? I said, yes. But I would say that it has been one of the challenges that I've said yes to that has been phenomenal and paid off greatly. Again, with all my experiences and knowing how to count and lean into your resources, I was able to do that in the 2 months we had. The project we were working on at that time was looking at the role of community health workers and how they can help communities increase breast and cervical cancer screenings. Later, we added colorectal cancer screenings as well. But needless to say, I went through that review, presented the evidence to the task force in June. It was my first one. Nerves were kicked in, however, eloquently presented, and the recommendation or the intervention evidence got recommended by the task force. And funny enough, one of the members of the task force, Dr. Fielden, who in my mind is one of the great public health champions from UCLA, the School of Public Health is named after him. That was his last task force meeting. He was retiring. And there was actually a celebration in his honor. So if folks look at my blog, they will see a picture of Dr. Fielden and my kids and myself. And one of the most cherishable moments from that picture is my little guy, my baby, just touching Dr. Fielden's cheek like he's known him for years. And I carry and cherish that. And it goes back to what I shared earlier about each of my kids play a role in my career. That, to me, one of the ones that stands out very quickly, because you see a challenge that was set for me 2 months earlier, took the challenge, 2 months later, was able to get through and present. And then in the end, it's culminated with this amazing experience with my child touching Dr. Fielden's cheek. And I mean, I don't have enough words for that. So yeah, I've been talking too much.
Well, thank you for sharing that. That was very informative and I think very helpful. So thank you for sharing all of that. So currently you work as a health service and system researcher at the CDC via the Bizzell Group LLC. So why did you want this job? Granted that you said a little bit earlier that you weren't really interested in the surveillance side of public health.
Yep. Okay. So after the fellowship, obviously, if you have followed the theme here, I like challenges. I needed another challenge. The opportunity presented itself. And I found out I was going to work with the epidemiology and surveillance branch. And epidemiology was now one of my favorite subjects when I was taking or doing my MPH. So I never envisioned myself really working even with epidemiologists. I just always envisioned myself with folks who were in the health services research field or policy field. But epidemiology, perhaps maybe an interaction, but actually working never crossed my mind. But again, why not, right? It's a challenge. And really, it's the division of heart disease and stroke. And the heart disease is the number one, the number one killer in the U.S. at least, perhaps global. The globally might just be more on the chronic condition side and not infectious disease side. And when I did the interview and they really spelled out what my role was going to be, it was more along the lines of bring in some of the skill sets I already had in health services research, because they wanted to focus on how to work on pop health again within that umbrella of heart disease and stroke. Population health was what I mean by pop health. So that made it seem doable and made it seem to me that, okay, so I'm bringing what I already know to the table, and in the process, perhaps get to learn more about how epidemiologists work and how surveillance actually does happen. And I will say that I've always just considered surveillance in the realm of infectious diseases, but for the first time, I'm seeing how surveillance is really relevant in the chronic disease world as well. And through my everyday task, it's becoming more relevant, and I can actually perhaps add that to my toolkit and say I do surveillance. I won't go as far as call myself an epidemiologist, but even if you look at the job description, some of the things that they write for epidemiologists, I already do now with the current role that I have. So it was a challenge that I took, and it's in a way paying off like everything else that I've said yes to in my life so far.
Okay. Yeah, thank you for sharing that. So what would you say is the most and least exciting part of this job that you're doing?
Yeah, that's a very good question. The most exciting, obviously, is being able to bring my lens of how to really consider the components of health services research in the work we do, right? And looking at it from the lens of, okay, we have this condition that pretty much all populations in the country face, but specifically there are disparities between populations. And so if we're doing surveillance work within this population, how can we consider components or fundamentals of doing health service research, such as what is the access to health for these populations? Are they actually able to afford, right, the interventions, be it, interventions around medications or any type of physician-ordered health behaviors that needs to be adjusted. And also looking at the quality of care that these communities already have, and how all of that is speaking to the efforts of this, all of that is helping with the surveillance data that we have about these populations, and how can we then use that information to ensure that whatever evidence is being implemented into interventions is actually going to be effective. And then we get into evaluation and all that piece on the other side. So that part is very exciting to me. The least exciting is, and we're all facing this with getting on calls. Sometimes when I get on a call and I don't feel like I contributed anything, just because it's one of those calls where somebody's just giving information or there's really nothing else I can add. That part can be least exciting, because you get on a call for a long time and like, oh, I didn't even say anything on that call. But I don't know if it's just everybody, we're all on Zoom calls or Skype, whichever platform anybody uses. I don't know if that has to do with it, and perhaps if it was more face-to-face, I wouldn't feel it that much. But yeah, that's the only part I find least exciting.
Okay, and thank you for sharing that. And it definitely is a lot to do with like having to do all these online calls. It is very tiring, and
Yeah,
especially if you're not engaging, it could be hard.
exactly.
Yeah,
I
definitely.
agree.
So switching gears a little bit here, I know that you have your own consulting company,
Yeah.
Tersha, or is it Tersha LLC?
Tersha LLC.
Okay.
Yeah, it's actually a combined name of my husband's name is Terrence and my name is Sharon, so we just put it together.
Love it, love it. So
Innovation.
why don't you talk a little bit about your company?
Yeah, so many years ago when we moved to Georgia, I think I want to say about 14 years ago, maybe less. Can't remember when we actually registered it. So again, going back to who we are and the why and then the end goal, we do foresee ourselves working not for somebody, but really working for ourselves. And at that time we didn't have a family yet, so it was easier to sort of navigate that thought process of doing that. So we set it up, we did most of the admin stuff at that time, and then wanted to see how can we grow the business, find business, etc. Well, obviously life also happened in the course, right? Nothing stands still. So there were mouths to feed, right? So we also needed to find ways of actually paying the bills and also having, again, have that end goal of how can we still be putting efforts in the business as we go along. So it's been on and off. There was a moment when, so for example, right before the CDC, there was a gap in there when I was home with the baby, or with all the kids really, but the baby taking most of the attention. Where I started building it a little bit, I was able to have a network of folks that I was doing consulting for a couple of months. And that has helped it to a point where it's doing okay. The book that I wrote is actually under the Tersha umbrella. So my children's book that I wrote recently is under the Tersha umbrella. So marketing it through that obviously keeps Tersha sort of thriving and not at a standstill. So it's the little things, and then we'll see how, with again the network that I'm building right now, how that will in turn, when we're ready to really full-time focus on it, how that will fester that into it a bit more.
Okay, and tell me, so what services do you all offer, or it seems like you plan to offer more services going into the future?
Absolutely. So at the time when I had that gap that I was building, I was offering an evaluation consulting. So it could just be simple projects such as looking at different proposals, evaluation proposals, and applying for them. The other aspect is data analytics, and my husband and I bring those skill sets to that work. I was recently inducted into an organization that is, it's a community of evaluators, but specifically culturally responsive and equitable evaluators. So I obviously, knowing culturally who I am and how it's important to maintain that context when you work with communities is very critical. So that's the expertise that the Tersha also brings with my skill set. My husband is in operations management with his work, and that involves a lot of project management style things. So he brings that expertise. And throughout, again, that time that I was working solely on Tersha, I was able to form relationships with other contractors, a couple of them international, and they have a vast different array of expertise. So for example, one is working in Nigeria right now, and he brings that health management information systems expertise. So what this helped created was this array of skill sets or capabilities for Tersha, that even if there's a project that comes across my desk that I can't focus on, any of the contractors can take it and run with it. And again, still keep Tersha growing in that regard.
Okay, thanks for sharing. And
Mm-hmm.
you also spoke about the children's book that you wrote. So
Yes.
why don't you tell us about that also?
Absolutely. So I wrote this when I was pregnant with my daughter. So
What is it called, by the way?
what is it called? Good question. So it's called Koli and Bosco the dog. Koli is the name of the old woman that is in the book, and Bosco, funny enough, we used to have a dog named Bosco. So this is technically dedicated to him. And it talks about really the three themes that go across the book. And when I wrote this in my mind, I really just wanted again, I already was pregnant with my daughter, so I had her in my mind, and I just wanted her to have some fundamentals of just humanity in her and in the other children is really what I hope for when I published it. It's community. Our communities are important, and we cannot lose fact of that. Friendships friendships are important. This book talks about a friendship between a woman and her dog, and we know how some people love their pets, and it talks about how friendship comes in different ways. And finally, being a good neighbor. We see in the story that the dog, Koli and the dog, or Koli and Bosco, the dog, and it's really Koli and Bosco, the dog in quotes, are going on one of their morning walks. They see fire coming out of this building, a smoke rather coming out of this building that it's on fire. And we see Bosco actually is the hero of the day because his barks lead the family out of the house safely, out through guiding them through the smoke. And again, the listening to his bark was able to direct them safely out of the house in time for the emergency services to be able to take care of the family. And he got awarded a plaque by the mayor of the town, and the name of the town is Wiggletown, if that you couldn't chuckle to that enough. So really that is in a nutshell a summary of the story and what I hope kids will get out of it. And it's really supposed to technically be a series. The first one, this one is the rescue from the fire. So I'd like to get to a point where I write the second one, hopefully soon, about what adventures Koli and Bosco take next.
Yeah, awesome. Thanks for sharing. And we will be looking out for the second version, and I'll definitely be sure to link the first one into the show notes.
I appreciate it.
Yeah. So I know we spoke well, you spoke a little bit about your vision for yourself in the future. And I just wanted to ask, like, what are your plans for the future? Like, what do you have, what do you envision your future for yourself looking like?
So I'll say two things. There's definitely the plan to go back to Ghana, right? As if I haven't said that enough. And I've maintained connections in the country to sort of help set the path, because there's obviously no way I can just get up one day and just show up in Ghana saying, I'm here. So I've been working with, when I would say work, just staying in touch with folks in the country and seeing how I can set that path. Again, whether it's consulting with the Ministry of Health, or even possibly I've now actually thought a bit further into the University of Ghana and see perhaps it could be teaching there, and then again find that connection to the Ministry of Health some way. And with my presence now at the CDC, I've learned that there's a CDC Africa. So if things line up, perhaps that could be a potential. I wouldn't mind, and I will actually love to work there because CDC is a great agency to be at. Then I guess for now, my work is really to just continue my contracting role that I currently have. Still continue building that network for potential businesses for Tersha. And I told you about the children's book, right? So see if I can dedicate some time to write that second book in the series. And really just, again, stay engaged with the family. It's a juggle, and it's finding that balance, right? Staying engaged with the kids. They're growing. My daughter is going to be 10 this year. We're hitting double digits, and it's scary for me. So just being present for them, because that's really my number one job, is to be their mom, and then everything else falls into place. So being there for my family, my extended family. I'm still connected very well to my faith, my local church. I serve there in the children's ministry. Before COVID, used to go and physically just sing with the kids. And now everything is online, but still find ways to engage with that community there. So that's sort of what it's going, the current, future, and then the ultimate end goal of going back to Ghana. That's the plan.
Okay, thank you for sharing that, and good luck on your journey. And I look forward to seeing everything unfold.
Thank you.
You're most welcome. So before we move on to the last section of the show, I know that throughout this interview today, you spoke a lot about mentorship, and I just wanted you to touch on like how much mentorship has meant to your career, and to who and where you are right now.
Yes. I would say that the whole idea of mentorship seemed a little foreign to me for a while. And it was actually just recently that I started even making connections to even family members are mentors, even though we don't associate that with them. And So now, even though I say one of my heroes of all time has always been my grandmother, I can actually look back and consider her a mentor, because that word now makes more sense to me, right? But in my professional world, I didn't really have any mentor when I was starting out very early in my career. And it wasn't until very late that I started really making sense out of what that means. And one of the, like I said, the very first influential one will be Dr. Claudio. And I think she set the stage for me to start paying attention to what the idea of mentorship meant and how important it is. And ever since then, I've come across various individuals who serve as mentors in different ways. And I will say, if there's any advice I can give, is that you can have several mentors feeding into you in different ways, in different forms. And also remember that it is a two-way street. It's not just about, hey, I'd like for you to be a mentor, and then just keep it at that and only reach out to that person when you need a letter of recommendation. No, show you care, because that person is investing in you. They probably also want something in return, even if it's not tangible. Just that sense of community and being able to have that sense of fulfillment of giving back, that is important. And I am also learning ways to also be a mentor. During the internship at Cape Town, I was fortunate to be able to be in a position where I mentored the other colleague that I went with, because she was a bit junior in her career path. And recently, and that's another thing too, making time. I gave a talk to actually the current class for Dr. Claudia's internship, and one of them reached out seeking mentorship. And I'm trying to coordinate how I can do that for them, again, with the busy schedule that I currently have. So it's again, in a nutshell, it's a two-way street. So take advantage. There are a lot of folks out there that I've found are willing to make the time and open their hearts to mentor folks who are starting off in their career. But also, as you're doing that, make sure you keep it a two-way street and not think of it as I'm only getting something from them. See how you can also give something back, even if it's not to the person directly, but to others coming behind you.
Yeah, and thank you for sharing that. I really agree with that and resonate with that. And I think that people sometimes they just want to take, but they never try to give value. And I think the more value you give, the more value you're going to get. So definitely,
Absolutely.
when you're looking for mentors, reach out with a value proposition and really show them that, okay, this is what benefit they can get from this experience, as well as you learning from them, because there's a lot to say there.
Mm-hmm.
Okay, so moving you on to the last round of the show, the Furious Five, the question I ask all guests.
Yes.
So number one, what advice would you give to a student trying to pursue a career in public health?
So this is, if anything, this is a great time to be in public health. From the pandemic to the national discourse on health equities, it's a prime time to be in the field. There's inequities that has plagued this nation for centuries. Other countries as well, right? Because from colonization to racism, not only here, but I just mentioned what I saw in Cape Town, right? There is more help needed to support this field. So, in a nutshell, really, if you're coming into this field, I always say that whatever vision we envision for ourselves, we have to be part of that solution to make it happen. So if we're on the outside saying, we wish things could be this way, we wish things could be that way, get in, help be part of that solution, and we can all get to that vision that we all seek. So basically that's really it. This is a time, get on board. We need all the help, we need all the different ways, and like you said in the very beginning, it's a multifaceted field, right? There's so many ways to approach problems, and the more diversity we can have in tackling the problems, because at the end of the day, it's about humanity at the core. And if we can find solutions that work for humanity, that's the golden standard for public health right there. So
Yeah, great answer. Thank you. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
yeah, really, I can sum it all up in one point: know your why. Because there's going to be challenges, there's going to be doubts, there's going to be moments where you don't even know what's going on, but you always bring yourself back to the why. And if it wasn't clear in everything that I've said, I will reiterate it. It's always been the why that brought me back to the reason behind the decisions that I make. And keeping the why at the center is what's going to help you get to that ultimate end goal, whatever it is for anybody, that vision that you have for yourself. So know your why.
Yeah, thank you. That is very powerful. Number three, what's something you are working on improving in your life right now?
Yes. So I am just like, I hope most folks in this country doing that internal work of paying attention to all our little biases, right? At the root of battling racism in our culture, we need to start by doing the internal work for ourselves. So looking into each person, looking into themselves. So that's what I'm doing right now, and I'll share a little bit of what I'm learning, and that is, so I've always, again, from my background, I obviously I guess on paper or even just looking at me, however you want to approach it, it could be categorized under the population of underserved populations, right? However, what I'm beginning to realize is and again, it goes back to my why. I chose to follow a path of going through systems of education. So I have and what that has done for me is giving me this position of privilege based on my education to speak for the underserved populations. However, internally, what I'm beginning to realize is that, oh, do not forget, I am still part of that community, irrespective of that privilege. And it's almost refreshing, and I don't know, it just feels good to recognize, oh, wait a minute, I am part of that population. My privilege just helps me recognize the issues and find ways to see how best I can help my community. But the reason why I'm able to do that is because I am part of that community. And it's more important to recognize. And the reason why that's important is because so many interventions in public health are done without including the communities at the table. And it's, even if there's representation like myself, that privilege that I bring gives me a different lens from somebody who doesn't. And it's always important for me to recognize that and bring that representation to that discussion table. And doing that internal work, I think is again what I'm working on now. And it's actually quite refreshing because it just brings to light how much better I can do my job and how much better I hope we can all do our jobs in public health. So that's
Yeah,
it.
thank you. Thank you so much. Number four, professionally, do you recommend anything? So it could be a book, a podcast, YouTube, or something
Yeah,
intangible.
there's been a few, I was saying. So I've read a number of good books over the years. So I have a couple, and of course, I'm not going to share. It will be a crime to not share a book that is related to my background, even if it's not from Ghana specifically, at least from the continent. One of the best, and it's a classic that almost every person who goes to school on the continent knows about, is Things Fall Apart by Chinua Achebe, or the late Chinua Achebe. And it's a classic because I like the way the author puts or works with the complexity of storytelling. So you read and you see how he weaves slavery with colonialism and just the whole concept of liberation and what that means in the realm of traditional beliefs in Nigeria, right? And when you see how the story unfolds and the complexity with which the author uses it to write, to me it's just remarkable. So I recommend that. And really one of Chinua Achebe's quotes that I love even up to date and so relevant to our field is, and I'll say the quote and I'll tell you what it means to me. It says, "Until lions have historians, the story of the hunt always favors the hunter." And it resonates with me. It's because evidence always has a perspective, right? And unless, so for, again, if it's favoring the hunter because that's a perspective we have. If we have the perspective of the lions, that is perhaps when we'll have the full story. So basically what it's telling me here is evidence always has a perspective. And until we seek out the other perspectives that might be available that are not at the table in front of us, we can never have the full picture. So that's one about Chinua Achebe. And currently, the book I'm finishing is The Political Determinants of Health by Daniel Dawes. And if you're interested in doing, who is a professor at Morehouse School of Medicine, if you're interested in doing equity work in this country, it's very critical you understand not only because social determinants has been tossed around a lot, but there's this aspect also of the infrastructure in our policies that are driving some of the status quo we have in our social determinants of health. So I highly recommend that as well. There are a lot of great phenomenal stuff out there. Any book on critical race theory is important, especially in these times. Kimberly Crenshaw and her work in intersectionality. I also encourage folks to learn from other phenomenal activists in public health like Loretta Jones, right? The pioneer of community partner participatory research. There's also William Jenkins, the late William Jenkins, who specifically fought for the medical services to be provided for those that underwent the Tuskegee study. So I could go on and on. There's great stuff out there, and I think people just need to want to explore and learn. So that's it.
Yeah, thank you for sharing some of those gems, and I'm definitely going to add a couple of those to my book list that I'm going to have to read this year.
Yeah. I will admit it's a process because my stack is like this, but it's just a few pages every day.
Yeah, it's the same thing with me. Like every day it's a new book, just get it added into it. I'm like, I don't have enough time, but
I know.
But yeah, it will get done. It will get done.
It will get done. It's a little at a time. A little at a time.
So last but not least, where can people connect with you?
Absolutely. So you mentioned my blog, so I can share those links with you as well. I'm also on Facebook and Twitter with the title of my book. So on Facebook, it's just Koli Bosco, KoliBosco. On Twitter is the same, but you just put the at Koli Bosco. And on LinkedIn, just if you search up Sharon Attipoe-Dorcoo, I should come up on LinkedIn. And still working on that website. So did put up one on Square, I believe, but it's not the best. So I don't like to rave about it. But yes, at least on social media, people can reach me.
Okay. Well, thank you so much. And I'll make sure to link all those different places people can connect with you in the show notes. And I really appreciate you taking your time to be on the show today and share your story. I think there are so many gems that you hit on in this episode. And I'm really excited to share this with everyone else.
Thank you so much for having me. It's really been a pleasure chatting with you. I truly enjoyed it.
I'm glad to hear that, and I will chat with you soon, and have a great rest of your day.
Thank you.
Well, I'm glad if you stuck around this long, and I hope that you took some value from this episode. I know I definitely did. This is a very unique story with Dr. Sharon, and I really appreciated everything that she had to share and really talking about the importance of mentorship and how her children have shaped her journey. And I'm really looking forward to seeing the more trailblazing that she's going to do in her career. But definitely subscribe, review, leave a like, share this with a friend, and I appreciate you listening. I hope everyone is doing well. Take care. Public at Millennial out.